Hello, and welcome to a very special briefcase that is part of a series I am leading on diversity, equity, and inclusivity with CME Outfitters. Today's CMEO briefcase is entitled Vaccines, Real-World Tactics to Address Health Inequities. Today's program is supported by an educational grant from Johnson & Johnson. I'm Dr. Monica Peak, and I'm the Ellen H. Block Professor of Health Justice in the Department of Medicine. And I'm also the Associate Director of the Chicago Center for Diabetes Translation Research and the Director of Research at the McLean Center for Clinical Medical Ethics, all at the University of Chicago in Chicago, Illinois. I'm delighted to be joined today by my distinguished colleagues, Dr. Otis Kirksey and Dr. Ray Mendez. Dr. Kirksey and Dr. Mendez, would you be willing to introduce yourselves?
Hello, and thank you, Dr. Peak. I'm Dr. Otis Kirksey. I'm the Director of Pharmacy Services at Neighborhood Medical Center, Inc. I'm also the President of Healthcare and Education for the American Diabetes Association. In addition, I'm Professor Emeritus of Pharmacy Practice at the Florida A&M University College of Pharmacy and Pharmaceutical Sciences, located in Tallahassee, Florida.
Thank you so much. It's wonderful having you with us. I have really enjoyed working with you at the American Diabetes Association. Dr. Mendez, would you introduce yourself?
Hello, and thank you, Dr. Peak. I'm Dr. Ray Mendez. I'm the medical director for Me Medical Primary Care Clinic, as well as the health system clinician, family and community medicine department at Northwestern University Feinberg School of Medicine. I also serve as a clinical instructor at Rush University Medical College in Chicago. Thank you for having me.
Welcome, native Chicagoan. Happy to have you here. Okay. I'm excited about today's discussion. Our first learning objective for today is to identify the impact of health inequities on vaccine optimization. And so that is something that I personally have spent a lot of time in the past several years during the pandemic talking about, but it's something that is not unique to the COVID vaccine. And so I'm really excited for our discussion today. Before we start, I want to remind our audience that this CMEO briefcase is a continuation of our initiative to address unconscious bias, health disparities, and racial inequalities. We are building a comprehensive library of educational activities to address these important issues, and today's activity continues the discussion in vaccination. On this slide are just some of the titles of the activities in this series, with links to each of them. To view any of these programs, simply click on the activity title in the slides. If you participate in at least 3 of the programs in our D&I Hub, you will also be eligible to receive a digital badge demonstrating your commitment to education on diversity, equity, and inclusivity. As we begin to address vaccination disparities, I do want to review some foundational points regarding historical racism that remind us all how we got here. We've done previous programs to cover these topics in depth, and those programs can be found in our D&I Hub. We have groundwater issues, and I encourage everyone to participate in our foundational programs so we can learn more and all do better. But to try and quickly sort of summarize, the groundwater issue is structural racism, and that affects all of the issues that we'll be talking about throughout our programs with chronic diseases, with prevention. And what that means is that it's at the very root of the disparities that we see as far as the social determinants of health and how they're distributed unequally in populations, as far as exposure to crime and poverty and opportunities for education and employment, things that are considered basic human needs and rights like food, access to clean water, clean air, things that are in the environment, protection from toxins and exposure in the environment, things that are built in the environment that people should have access to. All of the things that we need to live a healthy life, those are disproportionately present in white neighborhoods and disproportionately present in lower amounts, if at all, in communities that are lower income and communities of color. And so this structural racism sets the groundwork for us then having the indirect effects of those. And they occur in the larger community, but they also occur within the healthcare system. And we see that being manifest initially as provider bias. when we move into how that works to impact individuals, we see that we have individuals who are directly impacted and that they're stressed about it and it affects their mental health, but also begins to change their physiology. It changes their autonomic function. It increases their cortisol levels. That chronic stress affects their HPA axis. And it also affects things like access to care. And the physicians that are in those healthcare systems, it affects the kind of care that they deliver to patients. So we begin to see deviations from standards of care, or SOC. And so what we ultimately start seeing is that structural racism affects the health of the patients that are most marginalized. And when they need the care of those health systems, those care systems are less able to provide the kind of care that those persons need, because they're structured in a way to provide worse quality care, or to are less likely to be able to let those people in. And so then we see the long-term impacts as far as manifestations of chronic disease with pro-inflammatory states, with shortening of telomeres and genetic alterations of patients that really set them up for not only changes in themselves, but also intergenerational changes as far as chronic diseases for their children and their children's children, we're beginning to understand. And not only that, but we have set up intergenerational patterns of distrust of healthcare systems, those very systems that we need to provide that care. And so we see that people are less likely to go for care, that those care systems are less likely to retain people, that people are less likely to adhere to the recommendations for care. And all of these are things that we saw being manifested during the pandemic. And so no better time than to talk about vaccinations than right here today, in this larger context that I've just laid out for us. So before we dive into this, we're going to do our first audience response question, which is, how often do you consider social determinants of health when crafting individual treatment and vaccination plan? So right now you can go ahead and vote, and we will just give a second for you to do so before we move into our first patient case. So let's go ahead and start, Ray, by introducing our first case. And can you tell us about Samantha and Jackson?
Yes, I would love to. So today we have Samantha, a 21-year-old first-time mom who brings her 2-year-old son, Jackson, for a joint appointment at the primary care clinic. Jackson developed a runny nose, decreased appetite, fever, and a barky cough. Samantha has similar symptoms. She was awake with him in the bathroom trying to get him to breathe in steam and sleep upright due to the cough. Samantha says, "I was going to take him to the ER last night, and I had to take the day off to see you today. Does he have pneumonia? Does he need to go to the hospital?" And then on this slide, we're talking about Samantha Jackson a little bit more detail. So Jackson is Black Hispanic, height 37 inches, weight 35 pounds, no history of asthma or allergies. Samantha is Black. Health history includes substance use disorder and resolved hepatitis C infection. Samantha is a single mom, and Jackson routinely goes to daycare. No health insurance coverage is reported, and upon routine questioning, Samantha reports that Jackson vaccines are not up to date. And so here we notice, a number of different social determinants of health that can be addressed and should be considered when addressing this patient's concerns and overall creating a treatment plan. We notice that Samantha has no insurance coverage for herself or her son, who's 2 years old, as well as she's a single mom. And so that brings into consideration the social and community context, the stressors that she probably deals with on a daily basis, with having to be both a father and a mother, and then having to juggle work. And then she also has a history of a substance use disorder, which, points to some kind of background that surrounds probably some kind of trauma or some kind of mental illness that was probably a result of her upbringing or of recent traumas. Usually substance use disorders is tied to some of those things, so we can strongly consider Samantha also had a lot of health inequities that she had to overcome just to, make it to where she's at right now. And the fact that she's able to bring, Jackson to the primary care clinic despite all those barriers is quite impressive.
Absolutely. Absolutely. All right. So now that we've heard a bit about Samantha and Jackson, what should the clinician consider when selecting vaccines for Jackson? And this is an audience response question. So we have 5 options again. So as we alluded to in the beginning of this activity, health disparities and inequities are deeply rooted in systemic racism, which continues to impact the surrounding social and structural environments of our patients and thereby undermining their health outcomes. So Ray, Samantha is not alone in her current life circumstances. Is that true?
No, she's not. It affects so many people, Black and brown alike. And Samantha is a perfect example of why we shouldn't have a cookie cutter approach to, our vaccine discussions with every single patient, and why we should be a little bit more considerate and take our time when approaching patients that are in a vulnerable situation, such as Samantha and Jackson. And so, some of the important facts that we wanted to review here is that there's a huge burden placed on Black mothers, just like Samantha. She's had a large, complicated life, probably with a cumulative burden of chronic stressors and different, life events that we have no idea, we have no way of, really knowing. And so we have to come with her with a tremendous amount of humility. And so a couple of important points we wanted just to state. Black mothers and individuals with fewer years of education are more likely to report vaccine hesitancy. And I think we see that in a number of different settings, not just the primary care settings. And there are studies showing that non-Hispanic Black mothers were more likely to have some hesitancy regarding the COVID-19 vaccine when compared to non-Hispanic white mothers. And that's, 40% versus 19% respectively. Additionally, there's a long history of racism in the healthcare setting. So, I feel like some of our communities, some of the Black and brown communities, are used to not receiving high quality care, the patient health education that they deserve and they need to make these medical decisions for themselves and their children. And that directly ties to some of the socioeconomic statuses that our families have as well. The poorer you are, the lack of insurance, you're less likely to have access to vaccines. You're less likely to be able to obtain a primary care doctor appointment. You're less likely to even want to seek out medical care because of the fear of cost. And so, Samantha is not alone in this. And that's why, approaching her with a tremendous amount of humility and a strong consideration of her background is critical for, successful vaccination of her and her child. But yeah, Dr. Kirksey, did you have anything else you wanted to add?
Yeah, I think you hit on some very valid points. She's not by herself. I mean, Black women of color deal with this every day. In addition to the stresses of life, paying bills, childcare, working 2 full-time jobs to make the salary of a decent full-time job. All of that, comes to play here. Having someone who they can recognize, at the clinic, someone who they can identify with, feel comfortable establishing a one-on-one relationship, ensures the kind of confidence they have and kind of negates the distrust that we see so much in the community. I think that we all should approach patients with an empathetic heart, putting ourselves in their place and to ensure that we are providing the level of care that we would want for our own selves. So, yes.
Absolutely. And we know that particularly we saw during the COVID pandemic that when messages were coming from people from the community, either from community health workers or from physicians, politicians, trusted members of the community, leaders who were saying that this is important for us,
Yes.
get behind this, this is safe for us, that people were more likely to listen to those messages. But I also think it's important that we recognize that access is sometimes a bigger issue for some of the communities than hesitancy. And this was also, again, particularly true during COVID when, it was a very scarce resource the resource went to people who were lowest risk first, to the wealthy and white, rather than the poor and the brown and black. And so even before people could express their hesitancy, they couldn't even get it because it was going to other communities. And so I think we a lot of times want to make sure that people have the full access to the range of resources that are out there, and that we are doing our due diligence to make sure that we have safe spaces, places, and people to provide those services that we want people to have. And so I think one of the options was refer them to a public health clinic 3 months down. Like, that's not, you want to give people what they need right then when you have them in front of you. She already is working, multiple jobs, and the last thing she needs is to take more time off work when it's inconvenient for something that is, preventive care. And so being able to meet people where they are is how we're going to be able to get all the services that we need to our patients who have so many things that they're trying to juggle.
Yes.
All right. Anything else you want to add to this discussion before we move on to our next slide? And so there's always some overlap between these complicated connections that we've been discussing, particularly related to social determinants of health, and which ones are key that clinicians should consider, especially related to the patient's vaccination status. And so, Ray, what do you think about all of this?
Yeah, there's so many. We could probably spend a couple hours just talking about the social determinants of health and vaccine equity. But specifically regards to the COVID-19 vaccine, we did see a lot of barriers in all communities, and all diverse communities, not just the Black and Brown communities, but specifically in the Black and Brown communities. There was a huge lack of, just customized or culturally appropriate information. There was, things weren't available in the appropriate language. We don't even have enough, Black and Brown doctors to be able to, create marketing materials and really reach out to these communities. They weren't selected. They weren't asked to participate and get the message out. There's so many issues with that. There's a huge mistrust in the medical system from both Black and Brown communities alike, Latino and Black communities. So we should have utilized our minority community, our minority professional community a little bit more as well. So those are some of the barriers. And then just speaking specifically to the Black and Brown community family, we definitely could have joined forces a little bit better with these larger institutions to ensure that the communities that we were serving were having access to a lot of these resources and just information that would allow them to be more comfortable with obtaining vaccinations. And then lastly, of course, health literacy was a huge barrier. I think that ties into so many social determinants of health that we know so well, just specifically talking about like education, access to education quality that we have. And so, trying to create, a general message for the entire community is not effective if we don't take into consideration, just basic literacy and health literacy as well. And then, discussing some of the key points and concerns that patients may have, such as, where can they obtain the vaccines in their community? I'm sure Dr. Kirksey can speak more to this, but about some of the access to some of the pharmacies, the lack of pharmacies, and then, considering just insurance coverage, what happens when you don't have insurance? What happens when you have Medicaid? What happens when you have, private insurance? Does it matter how old you are? And, all these other questions that patients had. But then also there's a lot of other barriers that people are not commonly aware of. So you have to think about, Medicaid in some states, and managed care is taking over much of Medicaid now. And so a lot of patients will have assigned providers when they have Medicaid, but if you speak to them, like I see a lot of them in the emergency department setting, and they don't really know who their primary care doctor is, who's assigned to them. And, that's a huge problem, because then once they find that out, they call them, and then there's no access. There aren't any appointments for weeks to months.
Yeah.
And then some of the patients don't truly understand what an FQHC is, because I didn't understand what an FQHC was until I was well out of medical school. And so I can't imagine like the uphill battle many of these families are facing. And so, it's imperative that, as clinicians, as providers, that we take our time to get to know each and every patient and don't rush it and don't make assumptions and just sit down and have a conversation with them. If you know your patients really well, that makes it so much easier. And that's the beauty of primary care. But, that's not the reality that we see every day. And so you're going to have to approach every single patient with a customized fashion. So, and then they did mention also government fears, which, definitely is a huge problem in the Latino community where, they don't want to utilize governmental resources or public resources because they're afraid of something called public charge. And
Yes.
so the idea behind that is if they utilize any free services provided by the government, such as free COVID care at hospitals and clinics or free vaccinations, they're afraid that that's going to count against them and that may prevent them from becoming citizen in the future or just obtaining their green card. And so all these are barriers that you really have to take into consideration and really have to educate yourself as a provider, which is pretty impressive already. That all the material you have to digest, but on top of that, you have to know more than just medicine.
Right. Absolutely. And I think an additional layer with the COVID vaccinations, in addition to thinking about the public charge when everyone's offering free vaccines, was when there are a lot of these sort of pop-up spots, because it was when in the early days when it was still a scarce resource, a lot of them they called on the National Guard to help administer them. And so people were going into places where there were like military persons who are helping protect this, sacred resource. And people were like, is that ICE? Am I going to go in there for a vaccine and then not be allowed to come back out? And so I think there are all of the, we have to, as institutions, think about how what our community facing front looks like, and what message are we intentionally or unintentionally sending to our patients. We have to be more trustworthy than when we have been in the past. So thank you both for this fantastic discussion so far. It was lovely talking to you all. We are going to shift now to our second learning objective. We know that the data has shown some vaccine hesitancy in underserved patients. And we've discussed the social determinants of health that often exacerbate these issues. So our second learning objective for today is to individualize treatment strategies that include the assessment of social determinants of health to improve vaccination outcomes. So Ray, let's check back in on Samantha and Jackson. Why don't you update us on their case?
Given Jackson's symptoms, he was tested for COVID, flu, and RSV, and it resulted that he tested positive for RSV. Some of the treatment options for RSV include acetaminophen and ibuprofen for symptomatic control. And specifically, Samantha asked, what is RSV? And she shares that she has and continues to feel neglected in her medical treatment, which has contributed to her distrust of the healthcare system and not having her vaccinations up to date, which is a common situation we find in many patients. Her treatment for substance use disorder and history of hepatitis C definitely impacted her care during pregnancy, and she felt ignored by nurses after being in pain postpartum and was not provided adequate pain treatment. And so I'm sure she was definitely concerned about, a lack of treatment or lack of appropriate care for Jackson with his new diagnosis of RSV. And so the goal for as a provider here is to get Jackson and Samantha up to date on the vaccines while still addressing, the current RSV infection that she has. And on top of that, trying to address her concerns about the past missed treatment that she's had. And so, that was something I just wanted to highlight there. But RSV can be is an upper respiratory infection that can be serious in young children. RSV vaccines are in the pipeline. And so once available, this is going to help tremendously to decrease risks of future infections, especially if mom gets the vaccine. And so, these are all important factors because how you address Samantha today is going to impact her perception of the healthcare system in the future and may even influence her decision to get the RSV vaccine in the future once it's, fully developed and matured.
Absolutely. Absolutely. So Otis, this is where you come in. So Samantha has a handful of vaccines to receive in order to become up to date. While we do provide vaccines in the clinic, Samantha can also get a number of vaccines at a local pharmacy as well. What is the role of a pharmacist in managing vaccines for patients like Samantha and Jackson?
Well, very good question. Since COVID, pharmacists' role have expanded significantly. They played a very important role in dealing with the COVID epidemic. Now, pharmacists, pharmacy interns, and pharmacy technicians in some states can all administer vaccines. So, the training is, they have training programs to ensure that they are up to date with all of the guidelines and side effects, even treatment protocols for emergency, for allergic reactions that occur if they occur on site. But I think the most important role pharmacists provide is that of educating the public.
Right.
They are so accessible and approachable. And so, making sure that those pharmacists have adequate information that is written to address the population of people that they serve, cannot be underestimated. I think you provide them with useful resources and they can really make big benefits. I think one of the things that they were able to do during the COVID pandemic is, African Americans and people of color were hit disproportionately by COVID. If you look at the initial deaths, I think 40% of the deaths, people had diabetes. And so these people already, sick and marginalized. But yet the Black pharmacists, they actually played a big role in the community through their connections with other organizations such as fraternities, civic organizations. They actually went out, health fairs and churches, to educate the public to make sure that they had the right information. Because what was very interesting is that for our populations of people that I manage, there's limited culturally appropriate information targeting them, but yet there was an abundance of misinformation that was available online and through social chat rooms and so forth. And I think one of the huge barriers that people don't talk about a lot is access to social media and misinformation. Because, personally, as a pharmacist with two adult daughters who come to me, anything, prescription medication related, they always call it POP, but yet they would not take my recommendations as it relates to getting the COVID vaccine. That's so yeah, pharmacists are rightly positioned to play a very important role, and they're doing it every day.
And especially a lot of times people see their pharmacist more frequently than they see their doctor, because they have all these different medications that need to be refilled at different times.
And so, have a better relationship, in terms of being able to communicate. Sometimes, going to the doctor can be very intimidating.
Yes.
Even for those of us who are not, social and economic, disadvantaged. I mean, just going to the doctor can be very intimidating. But it seems to be something calming and, about going and talking to, neighborhood pharmacists, because they see them so often.
Yes.
While they're doing the grocery shopping, they see them at church and so forth. So yes, they are very accessible.
Yes, right there in the community. You see them all the time. And so they're an increasing source of education, as well as vaccines, in addition to their medication. So
I would like to mention just one thing, one additional thing as it relates to access. But we are seeing a growing number of pharmacies pull out of those neighborhoods that need them so desperately. Pharmacy deserts are being created throughout the country, and it creates a huge void to and a barrier to access to very important care. Yes,
exactly. We have all kind of deserts in marginalized communities, and pharmacy deserts are certainly there and getting worse in a lot of ways. We are going to revisit two of our audience response questions. The first of which is now, after today's session, how often will you consider social determinants of health when crafting individual treatment plans? Your 5 options, again, you'll see them on the screen. You can go ahead and vote. Our second audience response question is, what should the provider do when considering social determinants of health for individualized treatment plans and vaccine optimization? So Ray, as you and Otis noted, providing accessible options for Samantha and Jackson to obtain vaccines and hopefully soon to be up to date is critical. How do we individualize equitable care for our patients?
Yeah, so it's a great question. There's a lot of ways to do it. There, you can when you're creating a treatment plan, creating it with the patient. But I think, taking into consideration social determinants of health is so important. You have to consider the age, transportation, financial situation, the culture of the patient, socioeconomic status, among other things. There are definitely tools that you can use to assess an individual patient's needs as well, that just really highlight some of the social determinants of health you should take into consideration. There's a number of them, but many of them are actually can be embedded into electronic medical records as well. And I think we're going to go through some of those options later, as well as some specific tools. But more importantly, I just wanted to mention that, there's a new movement, a new idea of contextualizing care, right? Contextualizing care and giving treatment plans to your patients that are fitted for their life and their life circumstances. Not, if you order vaccines for someone before you see them, you may be wasting your time because they may defer them. You may have to go back and unsign those orders, and it's going to take you more time to do that as well. And then you may actually create a larger barrier. You may actually spend more time educating them than you would have if you had approached them first and asked them. So it's so important to create a customized treatment plan and contextualize your care plan to the patient's situation. So I just wanted to mention that because it's so important for everyone to consider doing that. And then you have to consider just their access issues, right? They may have vaccine access issues. They may not have pharmacies in the neighborhood. They may not want to go to the local public health department to get their vaccines. So just try to get them to get the vaccines at your clinic is so critical. And then you also lastly have to evaluate the environmental factors. So there's the environmental and just their genetic factors, right? So there's the family history that's so important, but then also there's environmental exposures that you really have to consider when just giving them a treatment plan. And you can also ask, what faith-based and community-based efforts are addressing social determinants of health in your region. And that's getting to know your community-based organizations, right? Because they may be, affiliated with some local community organizations or religious organizations that you can utilize to really advocate for vaccinations. And if you partner up with them, some of those organizations, they may feel more comfortable obtaining their vaccines, at those organizations. So it's something to really consider when you're talking to patients about treatment plans.
Yes, they have been super effective partners in doing this. Otis, do you have anything to add?
Yeah. Well, yeah, I would like, just bring to the point that, our perceptions of our patients matter, right? I mean, we have to first admit that we bring baggage to the table, right? We have biases that we are conscious of and may not be conscious of, unconscious bias. And so talking to, in this situation, we're talking about a parent trying to make decisions related to her young, child, which is already a very stressful situation. So if the goal is to get Jackson up to date on his vaccinations, negative language won't help at all. It's so important that we meet our patients where they are, and that we come in with open ears and open mind. And I mentioned earlier, empathetic heart, and taking into consideration all the cultural factors that these patients that influence the behaviors of these patients. One of the things that I always try to that I always encourage my students and remind them is that patients don't care about how much we know until they know how much we care. Yes. And I think that's very important, because once they understand that, now you really have a functional, bidirectional opportunity to discuss and talk. Mm-hmm. And I think it's important that we let patients know that, look, we are not the dictator, that it is a team effort. and that they ultimately make the decision. I always tell my patient, look, you're the pilot, I'm the navigator. Okay, I cannot pull the plane up if there's a mountain. I can only tell you that there's a mountain there. So, I think it's important that we empower our patients, with the information, the confidence to make those kind of decisions.
That is an excellent analogy. I am going to use that. I'll try and attribute you here on out. Really strong points from both of you about considering things to consider when developing treatment plans with our patients. Just excellent. So Ray, once Jackson becomes healthy, we want to get him up to date on all his vaccinations.
Mhm.
How do we individualize vaccination optimization in the pediatric population?
Oof, that is a very deep question, but we can give some basic points to help our clinicians move forward and improve their practices. So in general, you want to listen, right? You want to listen to your patient. You want to ask them, about their concerns. Shared decision making, motivational interviewing would be great as well. It's a great tool to also use. And you always want to ask for permission, from the parents as well, just to because if they say no, then you can move on to the question as to why, what their concerns are in a non-confrontational manner.
Mhm.
Getting to know your patient's concerns is the best way to develop trust in the patient as well, especially when there's so much mistrust in the community as well. So I think that's one of the primary goals. But then another thing we have to do in general, like a larger scale, is we have to begin advocating for health equity. We have to, start creating partnerships with not just families, but also community-based organizations as well. We have to be able to identify these social determinants of health. We have to identify some of the community strengths as well as the family strengths and utilize those to promote partnerships amongst the community members, families, and patients alike. And then we need to begin really addressing something that you spoke to at the beginning, was just, the racism that's prevalent throughout the healthcare system, right? And we have to promote anti-racist practices and policies at our institutions, whether small or large. And that's not an easy task, and it will be difficult, challenging, and frustrating. But it's so important for us to do that. And lastly, we have to address the vaccine hesitancy, but just by attending a session like this and by creating sessions like this, they're so important for providers to truly understand the basis for vaccine hesitancy, because there is a reason. It's not one reason. It's not just because they're Black or Latino or they don't speak English. It's so deep, and it's so complicated that we have to, for providers, we have to begin understanding the problems in order to truly address it. And that will result in improved outcomes in all populations, but especially the pediatric population.
Absolutely. Thank you so much for just beautifully articulating this sensitive nature of vaccines in infants and children. I think you have some patient resources that you recommend to your patients. Is that right? That you want to share with us?
Yeah. So there's a lot of resources we can use, for patients, but also for, it also helps for providers as well. There is a great series on, YouTube or the AMA website that really just talks about health inequities, and they've really spent a lot of time, invited a lot of guest speakers, which are very knowledgeable on there. There's a few short videos on solokiko.com that is really pediatric friendly as well, for parents, but providers as well, and your institutions. The Institute of Medicine has a number of different reports that are very informative for us. And then you can learn a little bit more about trauma-informed care as it pertains to health inequities and cultural implications surrounding immunization disparities and hesitancies. And some of those links are provided there as well. And then I am part of a board at the Health and Medicine Policy Research Group, and they have a great resource as well that you can look on, and then the links will be provided in the website. So a number of different resources I highly recommend checking out and seeing which one fits in your life.
Excellent. Thank you so much. Such a wealth of knowledge has been shared today. I know I learned several things. So now I'm going to ask the audience, What do you think the provider should do when considering social determinants of health for individualized treatment plans and vaccine optimization? So again, we're going to have 4 options. And then we have another audience response question now that we're nearing the end of our discussion. And so now, after hearing today's session, how confident are you in assessing social determinants of health in your patients in order to optimize vaccination rates in your patient population? Go ahead and vote. All right, so that was a wonderful discussion, and I feel like we really obtained some great clinical pearls that we can use to provide more culturally competent care to ensure vaccination optimization in our patients. And I want to just summarize our conversation with our SMART goals, which are specific, measurable, attainable, relevant, and timely. And so that's what I hope you'll take from this presentation to apply to your own practice. And so the ones for today are to meet patients where they are and ask open-ended questions regarding social determinants of health, to utilize an interdisciplinary team approach to optimizing vaccination rates, including utilizing other members of your team in your practice or in retail settings, and consider pop-up clinics. Third, review vaccine information with a patient and provide them with a tool that they can read and review in their native language. Fourth, discuss vaccines with patients and families. Remain open to questions and feedback. Don't rush patients or families to get vaccinated if they're not ready. And then last, review vaccine status with patients at each visit. So here are just some of the topics that we've covered so far, and we will be adding new content every month. CME Outfitters also has a diversity and inclusion hub with a number of excellent resources to share with your peers and your patients. To receive credit for today's activity, please complete the post-test and evaluation online. You can then download your certificate immediately. Thank you again, Otis and Ray, for joining me today, and thank you to our audience for joining us. Be safe and take care of yourselves so you can provide the best care for your patients, and especially our underserved patients.